Lorna, over to you.
Good afternoon, everybody. Thank you for joining us again on our weekly COVID-19 media briefing with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer for Montgomery County Government. And joining us, as every week, is Dr. Travis Gayles, our Health Officer, Dr. Earl Stoddard, who is the Director of the Office of Emergency Management and Homeland Security. Members of the media, I know you've been using the chat box to ask for permission to record, and we will be using that chat when we open for the Q&A portion of this presentation. And with that, I toss it to you, Mr. County Executive.
So, good afternoon again, and welcome to the weekly briefing. I want to start by remembering somebody that we lost, I think, this morning. Blanca King was a longtime employee of the county. Most recently, she's been employed in the police department. I actually remember her from her work at the test center in Silver Spring, which was a community outreach service center in Silver Spring. And this goes back many, many years ago. She's been a community activist and a prominent member of the Hispanic community. And when the apartment explosion occurred in the Long Branch community a couple of years ago, people remember her for just tireless devotion to trying to make sure we were able to help and serve this community and the people who had been victims of the explosion. And I just thought it was appropriate to take a moment just to remember her, because she had done a lot for the county. She was important in her community. And she's another tragic example that COVID is still very much with us. So I hope everybody can digest that. In the world of COVID today, we have a number of cases. We're at 359. Our positivity rate is down to 5.91, so we've gotten under 6 now. Hopefully we stay there. Our cases per 100,000 are still stubbornly high. They're at 33.7. Testing continues to be important because we can't control this if we don't know where the outbreaks are and isolate people, because if you get COVID and you're spreading it, it's going to continue to go viral through the community, and we don't have enough vaccine to tamp this thing down. The county has vaccinated 26,516 people to date through the county health department. And I realize there's some confusion out there. We actually have more vaccine than this in the county, but most of that vaccine, or about half that vaccine, I'd say, judging from the numbers I saw this morning, actually has gone to the hospitals and gone to the pharmacies. And so the county number doesn't always reflect, or doesn't reflect ever, the total number of vaccines that are in the community that we've been able to put out. But the county's been able to put virtually all of its vaccine into people's arms. The hospitals obviously have had trouble, and it wasn't management troubles. It was they anticipated that their employees would uptake the vaccine faster. It did not get taken as quickly. A couple of pharmacies were tasked with vaccinating nursing homes. They have not been able to do that as quickly as people anticipated. So when you look at the county as a whole, as a percentage, it's lower than we would like it to be. But the county health department has been very successful in getting vaccines out in the community. And again, you know, that goes to the work that's been done by Dr. Travis Gayles and Dr. Stoddard and Director Raymond Krell and all the other people who are working tirelessly. I can't even name everybody. Everybody's working tirelessly to make sure we vaccinate people. The big challenge is really supply, and that's not going to change. And I think, you know, for a while, none of us understood what the state's supply situation was. And a lot of people were wondering, where are the vaccines? Well, now we know. The state doesn't have them. The state is getting about 70,000 to maybe 75,000, in that range, of vaccines a week. And it's not guaranteed, but that's what they've been getting. Out of that share, that's what split and comes down to the counties. And so last week, our 5,500 doses we got were our share of about half of the total supply that the state brings down to the county health departments. And the other is going to other organizations the state is contracted with to get the vaccine out. Our number went down last week, but suburban hospitals went up because, as I understand it, what the state had was Pfizer, and they were able to greatly increase the amount of Pfizer vaccine, but the county health departments do not have refrigerators that are cold enough to hold the Pfizer vaccine. And so the state couldn't give it to us, and we couldn't have used it. It would have spoiled it, they given it to us. So those vaccines went out to suburban, and we'll be talking about this a little later on, but we are working with suburban to coordinate additional vaccines in the community. Yesterday, the governor laid out the challenge that our state and the country face in the crisis. It's pretty simple. You've got 300 million plus people living here, and you've got a tiny number of doses. The state of Maryland has over 6 million residents. We're getting doses at the pace of 70,000 doses a week. And remembering, since everybody has to have 2 doses, 6 million people would require 12 million doses. 70,000 a week doesn't go very far, very fast. And that's what we're up against. I know people are eager to get their shots, but until the supply changes, that is going to be very, very difficult. There are 2 million people in Maryland who are eligible for doses who are just in phase 1, just in that first phase. This week, we begin scheduling appointments for people 75 and older who are pre-registered for the vaccine. And this is, I gotta say, this is one of the other problems that we've had, is that the registration system was designed, it's the state registration, it's the state system that schedules you. It was designed for normal vaccines and people going on there and getting appointments in the normal world. It was not designed for COVID, and it was not designed for stages. So, for example, if you get sent to the state website because you're in group 1A, 1B, 1C, you can go on that website and it just tells you what places are available to vaccinate you throughout the state. You can put in 50 miles, 20, I think 25 miles, or whatever. It tells you where you can go get vaccinations. It does not adhere to the priorities of the state, which is, some of our frustration. So that we have the largest, when I talked to the governor, we have the largest population of people in group 1A, which is the first group we were supposed to vaccinate, the agreed upon #1 priority. But we have the largest number of people in that group. We still have not been able to get through that group, despite putting every vaccine we've gotten into the arms of those people. And so when the state opens up to 1B and now 1C, there are a lot of people trying to get scheduled for appointments, and we're still trying to finish 1A and move into the 1B group of adults 75 years and older. This is what we talked about. The governor and his folks realized this is a problem, and it's not just a Montgomery County problem. When you've got so many people trying to get vaccinated that far exceeds the supply of vaccine, and you have a system that can't differentiate between what group you fit in, people are getting appointments as quickly as they can get them, and they're not going in order. And so we're not able to focus on 75-year-olds because people are getting sent to clinics for vaccines who are younger than 75. It's a major problem. So we're hoping that the state, which is working with us, can help fix their scheduling apparatus. It would be really, really important. If we're going to do this effectively, though, we need people. If you get a letter saying you can register now, do not send that letter to your friends, because they don't have a number on their unique PIN that means that only you will get that vaccine. So if it's spread out among even more people, and there are people who aren't even of age, we've had examples of people who are in their 30s and 40s signing up to get vaccinated because somebody sent them a link and showed them how to get in. They are taking away vaccines from people who are in the highest priorities in the state. And we need people not to do that. So if you get an authorization that you can register, do not share it with your friends until we figure out how to put a unique identifier and have the state system able to identify it and block out anybody who tries to use that number twice. It is just adding to the problems of orderly scheduling, and it is putting people at the front of the line whose turn it is not yet. And there is a rationale for this order. We know why the front-facing workers are there. They are the people who are exposed to COVID every day in their line of work. They are our health workers. These are the people that everybody who's healthy, you need these people to be healthy, because if you get sick, you need these people to be able to help you. If you need our police department and fire department to be able to respond to calls. So that's why they were number one. The second group was the 75 plus group. We know that they're there because of the higher mortality rates in that group. And then it's the 65-year-olds, and then the teachers, because the governor has said that he wants kids back in school in some form. Nobody expects schools to fully open with every classroom full, just like it was last January. But there will be some going back, and we need the teachers who are going back to get vaccinated. So those are the first three priorities. In the county, we're still finishing 1A, starting 1B, which is the 75-year-olds. Our partnerships, which you'll hear about, are dealing with people who are outside of what the county's trying to focus on. The doses we get, we're trying to throw at the senior population so we can get them vaccinated. When we're done on the county side with the senior population, we will turn our attention to the 65 plus group, which is going to take a while to get vaccinated. But we're trying to get people to realize there has to be an orderly progression. There's a reason why it's been set up like this. And I feel the frustration. I can't tell you how many emails I've gotten from people who are eligible, 75-year-olds, who say, I go on the site, and by the time I get to the point where it says you can now schedule your vaccine, the site they tried to register on is full. I've gone on the site myself to see what it looks like, and there are I've been on there where every appointment is taken up. Because remember, the hospitals don't have a lot of supply. The pharmacies don't have a lot of supply. When Giant gets supply, I think it's going to be something like 200 doses. No, is it 50 doses a day? It's a really low number of doses a day for the pharmacies, the Giant foods that are going to be added to this. So with hundreds of thousands of people trying to get appointments and us having 20,000 at the most doses per week to do it with, those things are going to continue to shut down very, very quickly. Until we get a scheduling system that can meter the access to the vaccine based on the categories we're in, I think this is going to continue. So we need to solve that problem. So let me go back to our doses. So this week we received about 19,000 doses, and includes all our providers. Like I said, Suburban got an uptick in doses. They got 8,775. The county health department got 5,500. Kaiser Permanente, who we're also working with, got 1,950. NIH got 1,000, and Giant Pharmacies got 1,600. So I think there are 4 pharmacies, as I recall, that we're going to be doing this for Giant. So that's 400 doses per pharmacy. Divide that by 7 days a week, and you're looking at 60 doses, a little less than 60 doses per Giant pharmacy per day for a week. So telling you can go these places doesn't mean, and you should not expect, that they're going to be able to accommodate everybody asking for a schedule. One thing we did ask the state for is if they could commit to us a minimum amount of vaccine every week for new patients. They've been reluctant because they're not sure of what they're going to get. There are other states that have scheduled vaccines and then not gotten the doses that they anticipated. But the state is going to work on giving us a number, at least, a small enough number that they're relatively confident they can keep doing that. That'll allow us, when that happens, to start scheduling appointments more than a week in advance. But we and the health and the hospitals are going to be in the same boat until that happens. We're only going to know at the end of the week what we're going to get for the following week, just like the state doesn't know until the beginning of the week how many doses they're going to have to give out to the counties the following week. So all of us are in this line waiting to know what we need to know, but we're not going to be able to move that any faster. And I can't schedule a person 2 weeks out with any certainty until I know that the state's going to be able to provide X number of doses. And hopefully they'll give us a lowball number. We'll get those scheduled. And then as more doses comes in, we'll increase the number of people who can get vaccinated during those weeks. But this has been a really difficult time. I understand it. I got to say, nothing in the state or the county was built for this. And so we've had to stand these things up in the states. The states has discovered some of the flaws in their system. I'm happy that we're working with them now, and hopefully the situation will improve. We're encouraged that President Biden has talked about another 200 million doses. I want to remind people that we're in this box because the previous president chose not to buy all the doses that would have been available. And if he had bought more doses, we would have a more steady supply. But the companies that were producing doses, if the government here wasn't buying them, they sold them someplace else. And so we're buying more now. They're not going to arrive right away. I mean, the federal government's been very clear. I saw that Biden predicted a return back to normal sometime at the end of the summer, which gives you an idea of how long it's going to take to get the vaccines out there that would make it possible to return to normal. There is no normal until people are vaccinated. Let's just be honest about that. We don't get there until we get the vaccines done. So if you're between 65 and 74, there are vaccinations not managed by the county health department. They're at Kaiser Permanente, Giant Pharmacy, Adventist Healthcare, and the Suburban Hospital, Johns Hopkins Medicine Network. That's where you should go. And even if you get into the website that the state has and you see the option of Montgomery County Clinic, don't take that option. Please pick on the other options. Don't take away seats in our clinics from the 75-year-olds. We need to get this population done. So even though at the moment that may appear as an option, don't use it, please. I am begging people to let us try to orderly get through the more senior people in our community so we can deliver the vaccines where they were meant to be prioritized. When I talked to the governor, I said, if we get 65-year-olds registering on the county website, we're going to have to cancel those reservations and direct them to these clinics. And the governor said he agreed. I mean, our priorities are his priorities. I want to be clear about that. Their priority, they've been very clear that we need to do 75-year-olds first. We are going to do 75-year-olds first. There are other venues, and there's not enough vaccine, but there are other venues. People are going to have to be patient. But let us get through the 75-year-olds in our camp. When we're done with that, then we'll be opening up the 65-year-olds. These are really, really difficult times. I'm hoping that people can be patient. We were like month 11 now. Time flies when you're not having fun. And so we're in month 11, and to the extent that the county numbers are lower than a lot of other jurisdictions, it's because we've had pretty good adherence to our guidance, and because we've been a little bit stricter about what we've opened and not opened. We need people to be patient a while longer. The vaccines will arrive. We will get there. You will get vaccinated. And in the meantime, the only way you can stay safe is to minimize your contacts with other people. So give us another few months, give this country another few months to get to the point that we've got enough vaccine to start going around. Don't lose patience and start doing things that are only going to increase the risk to you and to the people you care about. That's my ask. It's the same ask I've been making for weeks. Let us get through this. Be patient. Wear your masks. Stay away from people, as hard as that may be. And we will get through this together. Thank you.
Thank you, Mr. County Executive. Dr. Gayles?
Good afternoon, everyone, and happy Wednesday. I hope you and your families are continuing to do well. I will keep my remarks brief to save time for questions. A couple things to highlight in addition to what the county executive mentioned on the general perspective. I know lots of questions are about vaccines, but just as a reminder, we're still in the midst of managing a pandemic, as evidenced by the number of cases we've seen across the state and across the country. Now, as he mentioned, our numbers are starting to trend downward. We have not seen a sustained level of improvement that we were looking for throughout the summer when we moved from one phase to the next. And so we'll continue to monitor those trends. In addition to looking at the numbers on the community transmission level, we also are continuing to monitor the potential introduction of variant strains within our community. We have had 3 UK variant strains identified in the state of Maryland, and just earlier this week we saw the first case identified in the Northern Virginia area. So we're continuing to monitor those, and it's of concern because those variant strains have demonstrated that they are more contagious and quicker to spread and more easily transmitted from person to person. So with all that in mind, we will continue to monitor and tweak and adjust the level of reopening or restrictions that we have in place. So stay tuned as we continue to monitor those trends. Now, to pivot to the vaccine perspective, I would like to say that in our week-to-week vaccine from Wednesday to the following Wednesday, up until yesterday, we had received 26,900 doses to the local health department. And with yesterday's clinic, we had administered 26,516 of those doses, which is approximately over 98% of the supply we received. We received an additional 5,500 doses yesterday that have gone into circulation today and will be administered through the health department apparatus. Now, the county, that apparatus is prioritizing, as the county executive mentioned, on individuals over the age of 75, as well as wrapping up any individuals who were left over from 1A. Let me repeat, the county apparatus is prioritizing 1A and individuals in 1B who are over the age of 75. All right. Now, the county executive mentioned that we have formed some partnerships and worked with our local hospitals and health centers, including all of the hospitals, and a number of them have stood up clinics starting this week, and one is in the works. Holy Cross and Adventist have stood up clinics beginning on Monday of this week. Actually started a little bit last week, but their clinics are for individuals in 1A, 1B, and 1C. So individuals who are over the age of 65 and fall into those essential employee categories, as well as those over 75, are able to register within those systems and obtain vaccine there. And obviously everybody is limited by the quantity that they have. Just because you're eligible, unfortunately, does not translate into having an automatic appointment. Now, the other opportunity that the county executive mentioned is we were made aware of this weekend through a partnership with Johns Hopkins and Suburban Hospital. Now, the state allocated approximately just over 8,700 doses to Johns Hopkins, and they reached out to us because their directive was to get these doses out to Montgomery County residents. And so we have worked with them over the weekend and over the last several days to discuss rolling that out, and that will be available for individuals who are part of their health system, who they've seen over the last several years, who fit the 1A, 1B, and 1C categories based upon age. They also will be working with our school system, starting with the public schools, to provide opportunities for vaccination for educators and teachers. And that, as the county executive mentioned, will be a critical component to being able to bring kids back into the school setting by offering additional protection for our educators and staff. We anticipate they will also be working with our non-public schools. And so all of those things are in the works, and they will be rolling those out. I believe they started their first vaccinations today to some of those folks within those categories. They will be executing that at 3 different sites, one in Germantown, one in the Bethesda area near the suburban campus, as well as a site at the Applied Physics Lab, which is actually in Howard County, but again, the doses will be earmarked for Montgomery County residents. Now, I did have the PowerPoint queued up ready to go, but again, in the interest of time, I think we've gone through those numbers. We'll be happy to answer any questions you all may have. Thank you.
Thank you, Dr. Gayles. Dr. Stoddard, do you have some opening remarks?
I want to make a few comments and sort of in furtherance with what the county executive said. So right now, the state prep mod system where we do registration is the system that we're talking about where people are sharing the links. Just to be clear, people fall outside of the priority groups that Dr. Gayles and the county executive have so clearly and eloquently described, the 1A folks and people in 1B phase, or 1B tier 1. If there are people outside of those who are utilizing these links, their appointments are going to be canceled out. And the other big thing that we've seen, and I think it's really important to illustrate, is we've actually had some second shot clinic links be shared. And what people can then do is register for a first shot for a clinic where we either may not have first shot to offer, and we are prohibited by the state from offering a second shot as a first shot. And so it's even possible that if people utilize the links for second dose clinics at a point when we don't have first doses to give, even people in the priority groups, including 1A and tier 1 of 1B, could be canceled because we just simply run out of 1A vaccine to give, and they're utilizing links that are not their second shot links to register for clinics. So this is a very complicated issue. We have reached out to the governor's office and as county executive alluded to try and address this issue with the registration system, such that it can, number one, give some modularity to the local jurisdictions about what the target of a clinic is and limit particular populations of it, but also so that we can ensure that a single link is good for a single registration, so that all the people who receive a link will actually have a slot that they can register into, instead of somebody who receives the link sharing it with their closest 5,000 friends and taking up the slots that were intended for people who receive the link. And so it's a work in progress from that perspective, but we are just, the key message out there is if you're trying to come to a county site and you do not receive an email with the link in it from C19 vaccination at montgomerycountymd.gov, your appointment may not be honored. I think that's as clear as I can make it. I think I'll stop there.
Thank you, Dr. Stoddard. And now we open it for the question and answer portion of the briefing, and we'll get started with you, Chris Gordon, MBC4, that has questions for all of you gentlemen.
Yes, thank you very much. You've addressed, Mr. County Executive, you've addressed the frustration that people are finding trying to register, going through a couple of pages only to get to like the 3rd or 4th page and being told there are no appointments. You've given us a variety of places now besides the county where people should start to look. Where should people go if they're eligible to register? What advice can you give them? What guidance at this point? Because a lot of them are going to the county site, and you're saying that might not get them to Suburban Hospital or Holy Cross or Johns Hopkins system. So where should they go?
So the county site's just going to get you pre-registered. And when you're pre-registered, when we're ready to schedule people, we send out notifications that ultimately, I guess, send them to the state site. But there's access, and maybe Dr. Stoddard or Dr. Gayles want to talk about how the access works for people who aren't going through the county site, because I don't believe you have to use the county site to get access to the state site. One of you, both of you, simultaneously in stereo.
Sure. I'm trying to be more considerate and make sure that I'm not jumping on people. Right now, the state website, and we actually have a link directly to the state site on our website. You can actually search by location. It gives you all the opportunities in your area. So Giant has a registration portal, Adventist has a registration portal, Holy Cross has a registration portal. They open up slots at different times, and you can find the information about when they open up slots on the respective websites. And so different locations have different opportunities based on who's distributing the information. We're trying to make it as easy as possible, having that searchable link right on our website. It does link right to the state. You can put it in your area, and it tells you all of the clinics that are in your immediate area. Then you can begin to look for opportunities at all of those. I think the key is, and I think the county executive described it well, There are very limited opportunities depending on where you go. The role of the county really is, and I think it's really important that we talk about this, the role of the county has really been to always be a safety net for those who can't get opportunities through other mechanisms. And so there's the link that you see goes right to the state. I think, thanks for sharing that. Once you click on that, there's a searchable by zip code. You scroll down slightly here and you can see it. And you can search right there by your zip code, and then you'll be able to see sites that are proximate to your location that you may be able to get a vaccine registration for. And then you'll see each of these has different opportunities, and you'll have to go through individually each of those to get access. There is not a statewide all opportunity pre-registration, and obviously that would be something that, you know, certainly the state may find helpful to do eventually. But right now it is basically either through the county for the county clinics or through the individual providers through their various mechanisms.
Thank you.
So can I make an appeal to Chris and to you, the other folks in the media? You know, there's been a lot of finger pointing, and that finger pointing is not helpful. It isn't going to solve anything. What I want people to understand in the community is that nobody is denying them vaccine, whether it's a giant pharmacy, whether it's going to be Kaiser, or whether it's going to be Hopkins, or whether it's the county. All of us are going to put out, and the county's been doing this, we're putting out every dose we can get. If you go on a site and it is locked down because all the appointments are given out, it's because all the appointments have been given out. I can't control, none of us can control the fact that the group that's eligible far exceeds the number of vaccines we'll ever be able to do in a week. With all of our forces behind together, we might get to 20,000 vaccines a week. And if this group is 200 to 300,000 people, it's just not going to happen right away. And so people need to understand that if they can't get on the schedule today, it has nothing to do with somebody not wanting to vaccinate them or, you know, not being willing to operate the system. It's just they ran out of slots. It's not good. It's not happy. But all of us are dealing with the vaccine limitation. And that is first and foremost why this has been so difficult. And for you guys who write about this, it would be really helpful if people realized, you know, you're looking for bad guys. There aren't bad guys here. There's just a lack of vaccine. And there is a bad guy you can hold accountable for that, but we're beyond accountability. We're moving to a new place now. But that going to a new place doesn't change what's available right now.
Okay, next question comes from Rebecca Tan from the Washington Post, and I believe she has questions for the three of you. Rebecca?
Thank you. I have two sets of questions. First of all, County Executive, earlier you mentioned that vaccination rates in the region aren't as high as expected at hospitals and nursing homes. Can you tell us what is the county doing to help nursing homes and hospitals right now, or is it your view that this is more of the state's jurisdiction?
Look, it's not my view. This isn't a matter of an opinion. It is a fact that the state provided the doses to the hospitals and to the pharmacies, and the state tasked them with what they were supposed to do. I can't explain the pharmacies and the inability to get things out to nursing homes. I don't understand it. They, you know, but we don't have a role to play. I don't have even the ability to make them do something they haven't done. The hospitals are a different case. I mean, I think the state gave them doses in good faith that their staff would take up the doses. And then what happened was the staff hasn't taken them up as rapidly as was anticipated, which has left them with doses that are available. And the state was clear that rather than sit on doses that are available for weeks and weeks at a time, get them out to people who need them. But this is not my personal opinion about things. This is who was responsible, how those responsibilities were laid out. We're responsible for the health department. We are doing our part to get everything we get out. I know the hospitals didn't deliberately hold on to vaccine, but they've been told to let stuff go now and work with us, and they are working with us. And hopefully the pharmacies will take care of the nursing homes.
if I could just rephrase slightly and tack on my second question, what we reported today is that vaccine uptake among nursing home employees who tend to be, Black and Latino residents who work minimum wage, the vaccine uptake among that group is very low. And so I think my question to the county is, what is the county doing to increase vaccine uptake within that specific group that includes a lot of nursing home workers?
So I'll start.
Oh, good, Earl.
Yeah, I was just going to say that I think that one of the things we've been really working on is using a similar model that we were very successful during the census process to get a great deal of participation from our very diverse population in Montgomery County. And so we've been utilizing through the Office of Community Partnership and all the network that they helped build for the census to try and do really targeted outreach to specific racial and ethnic demographics across the county to try and make everyone feel more comfortable with taking the vaccine. What I would say about vaccine hesitancy is it's going to be something that we're going to battle throughout this entire event in various groups and even in the general public. And so this is something that we view as a very long-term issue. We are doing focus groups with the Latino community this week. I think Sonia Morrow talked about this morning with our team. They're working on, we've got the survey that's currently out that we would encourage people to fill out so we can understand some of the different issues that people have with the vaccine, so we can develop, we can further our messaging to really address those things. We're targeting that survey into our more diverse groups to understand exactly what the different reasons why people don't take the vaccine are. We're actually working with some researchers that are interested in asking this similar question and working with us to assess the quality of our communications and how they're impacting various racial and ethnic groups. And so we've got a diverse number of things that we're working on right now to try and build a system that better addresses the concerns and needs of our communities, recognizing that there is not a one-size-fits-all communications network. And one of the big things that we heard is that some of the concern is less emotional, or is more emotional than it is based on science. And so we can't just throw facts and figures at people who are emotionally concerned about some of the risks of the vaccine. And so we're working on different mechanisms to communicate to those populations that try to address their very specific concerns. So I think we could have a whole presentation on this, and I think we'd be happy to talk about it, but the county is deeply engaged in trying to address this vaccine hesitancy question, and will be deeply engaged for as long as we're doing this vaccination process.
Thank you. Vicki Warren, Maryland Matters.
Sorry, did Dr. Gayles want to add something?
I think it's been adequately covered.
Thank you. Vicki Warren, Maryland Matters.
Yes, this is sort of a follow-up to the racial equity discussion that went on with the council on Monday in your briefing. And the fact that Mark just said that your health department doesn't have the freezer to administer Pfizer. So in a sense, Dr. Stoddard, you said the local health department is the safety net. So in order to get better sort of racial equity in terms of who's being vaccinated, isn't this complicated? I mean, how are we going to manage that if the increase in the doses is coming from Pfizer, and yet we don't have a way to access those doses?
Well, we actually do have a strategy to address that. And as I've mentioned in our testimony yesterday, we've reached out to our hospitals who do have storage capacity to be able to do deep storage, to form partnerships so we would be able to diversify the types of doses that we would receive. So that one, that would increase the potential yield, increase what we could potentially offer, and then at least in the short term, and one of the things that we haven't actually discussed that would also increase potential yield is the opportunity, hopefully within the next several weeks, if the data supports it, that there may be an additional vaccine candidate that's added to the mix. So we'll have more than just Pfizer and Moderna. And so, yeah, so we want to say a special thank you to our hospital partners who, when we reached out to ask if we could do that, they were able to provide that. So we're working to bring that online, and hopefully maybe as early as next week's allotment in terms of allocations, we'll be able to utilize that. Now, as part of the challenge with the different doses, and I want to take advantage of this opportunity to provide a little bit of education for the folks at home who may be watching, is that when people talk about doses being wasted or spoiled, they really are talking about the Pfizer doses. Because they're kept at such low temperatures, they have to be thawed out to be used. And by virtue of their shelf life, you can't thaw them out and then put them back in the freezer, if you will, to use. So they have to be used within a certain amount of time. Now, the Moderna shelf life is different. It's longer. And so there's, pluses and minuses with each of those. But in summary, we are working with our hospitals to be able to, even if we don't have the space, and I want to make sure folks also understand, at the beginning stage of the pandemic, for the vaccine, we were directed not to go out and purchase additional freezers. And so hence we don't have that capacity, but we have identified some potential spaces within the community to support.
Okay, this is just a follow-up. I know that Suburban is working through their MyChart portal, which basically addresses their patients, and Adventist is also going through their patient list. So again, in the community that doesn't have doctors, that doesn't frequent these particular hospitals, how do we get them into the Suburban portal? How do we get them into the Adventist portal and Holy Cross as well?
Well, one of the other pieces of the partnerships we're working with is the county being able to provide them access to names of individuals who have pre-registered through our system, who may be locked out of those networks. Now, there's a larger issue of there may be people who can't pre-register in our system due to not having technology as well. And so we are actually bringing on additional staff to support our call center. So individuals who fit the criteria, who are eligible, but may not necessarily have the technology to register online or may encounter difficulties, we're bringing in staff where they can call into the center and they can walk them through that process and get them registered. And I think the other thing to emphasize too is that we are really, as best as we can, trying to implement strategies to ensure fair access to the vaccine, so that, to your point, it's not just something that benefits those who are the haves, who have access, who have connections, who have technology, who have all those things, and that it really is penetrating within those communities that have been disproportionately impacted by COVID so far.
Thank you.
I would just add, the hospitals really, I think, because of the governor's directive that they need to have gotten 75% of their vaccine out to receive more. Their initial reaction was, let's get as much doses out as we can so we can reopen turn the faucet back on of vaccine coming in. They are very interested in following equity-based principles. Hopkins actually talked about having a panel of ethicists working with them to be able to look at how they distribute vaccine and target it, whether by geography or other characteristics that not only does it address racial and other equity questions, but it also addresses the fact that viral spread in Montgomery County has been disproportionate in certain communities. And so if you want to break these chains of transmission, targeting the vaccine towards those areas makes a whole lot of sense from a whole community perspective. And so they recognize this too. And so I think, as obviously some of these apparatus were stood up very quickly, and there are other more sustainable, durable systems that are being set up. I expect you'll see more emphasis on equity as the systems really get ramped up and built out.
Thank you very much.
Thank you. Kate Ryan, WTOP, questions for Dr. Gayles and the county executive. Kate?
Thank you. Thank you so much. And I'll take responses from anyone who has the answers. I'm not going to be picky. I do want to go back to, and forgive me, but I think we can't be, basic enough on this. I want a vaccination. I go to either the state or the county portal to pre-register. Once I am pre-registered there, I am good to go, correct?
Dr. Stoddard actually is coordinating the pre-registration.
Sure.
You are pre-registered for Montgomery County, I think, government sites. If you are not pre-registered for Giants, you are not pre-registered for Kaiser, you are not pre-registered for Adventist, you are not pre-registered for Hopkins. It is for the county vaccination sites that you are pre-registered for. we will work in concert with those other, other locations. So like Dr. Gayles said, there may be more opportunities for share people on our list into their clinics.
Right.
But that doesn't automatically guarantee you that the only pool of people that will be drawn from for any site in Montgomery County will be our pre-registration.
Thank you, because that's what I want to get to. Should people register on all of them, suburban, giant, et cetera, or are they gumming up the works by doing that? This is where I think we're running into a lot of confusion.
Well, you introduced the fact that by over-registering and trying to saturate the system, you thereby lock up appointments that could be shared with other folks. And we recognize the frustration within this, but this speaks to, again, as the county executive mentioned, this is a function of inadequate supply of the vaccine that doesn't allow for us to be able to offer more doses, to be able to offer access at all of these different points for all of the different eligible folks. So we're asking people not to do what you just mentioned as best as they can, recognizing, however, there is a lot of anxiety and there's a lot of desire to get the vaccines in any way, shape, or form that they can.
So should I register at one and just stop there? I mean, again, I think people are looking for, tell me what to do.
Yeah, I think the big thing I would say is this. I think we know what people are going to do, which is they're likely going to look for multiple opportunities and take whatever comes available to them first. I think the big encouragement that we would have, because I think we could say what we want people to do, but I think we know that people are going to try and get if they're eligible, they're going to try and get whatever vaccine they can get. I think the big thing would be that we would strongly request that if you do that, please, when you get an opportunity that is what you're going to utilize, cancel the other opportunities or make it clear that you're not going to accept the other opportunities, so you're not holding slots that you do not intend to use. We have had some number of people signed up for our county clinics who just simply do not show up. And those are missed opportunities. If we knew that people were not going to show up, we would reschedule other people to come into the same clinics and thus move the process along faster. And so independent of what we're, I think sort of aside from what we're recommending that people do, we know that what people will do just because of the concern that's in the public. We just ask that if people are going to do it, once you have the opportunity that you think is best for you, please do cancel the other opportunities as soon as possible.
Got it. And a quick follow-up there. What about the Southwest model? We talked earlier in these meetings about, hey, if we're moving on to a new group, it doesn't mean that group in 1A or 1B can't get seen. So how do you handle the people who are in 1C saying, hey, we're supposed to be allowed, right? How do you handle that?
But they're not supposed to be allowed. The governor was very clear. I got to say this again. You can read their own guidance. Priority is 75 plus. As long as we're doing 75 plus, they're not equally entitled to a seat in that line until we're done with 75 plus. I think this has been one of the misconceptions because people read that everything is open.
Right.
Now, if you're in all these groups, you can do it. You're not listening to the part where the governor says, by the way, there's very little vaccine. It's going to be a long time before you get scheduled. And by the way, the counties have to focus on the 75 plus first.
Thank you.
So it's there, but it's really not there. This is one of the problems. If it had been me, I wouldn't have opened up that many more slots, that many more people, the slots that weren't available, because it's created, as you kind of alluded to, this enormous sense that I'm 1C, I should be able to get vaccinated now. It's just unfortunately not true.
Right. And then lastly,
can I describe dysfunctionally, Kate, I think it's very important because I think it's dysfunctionally how this works, right? So if you're a healthcare worker, you may get an invite again for clinics this week. You'll get a short period of time where you can go in and pick a slot. If you take too long to pick a slot, we're going to send it out to the next group of 75 and older residents, which we have so many of them right now that those will fill up the remainder of the slots. Right. As we get through 75 and older, and they start to take, there starts to be slots that are not being filled, we'll start adding in the next pool of people into that list. That's how when we describe the Southwest model, I know that Dr. Gayles doesn't love that terminology, but it really is describing that we're giving, priority 1A is going to get the first shot at slots. They're not taking them all up now because we've gotten to the point now where we've saturated enough of that market and there's enough hesitancy where we're just not filling up all the slots. Okay, we're going to start offering it to the next group. Right now in 75 plus, there are way more people that are going to take the slots than we have slots, and so it's sort of they just fill up quickly. At a certain point in time, it'll start to we'll have vaccinated enough 75-year-olds where we're not filling those slots as quickly as possible. So we're going to move into the tier 2 group. That's when we describe the model that we're describing. That's really functionally how it works, is that there are still healthcare workers in Montgomery County that will be vaccinated at Montgomery County sites this week. They are just not taking up the slots as fast enough, so we're giving it to the 75-year-olds, and we'll continue down that pathway until we get to the end.
Okay, last one for clarification. When we say we've got 18,000 or 5,500 here or there, what does that mean for the second vaccination that I have to get? Are those, when you get them, do you have to take some and set them aside? How are those being done?
I'm sorry, could you repeat the question? I was
Sure. No, that's okay. I totally understand. So again, when we get the numbers of vaccines, let's say you got 10,000 today, do you have to set aside of that 10,000 the second shots, or no, those come in a next shipment a week or two from now? I think people are wondering where the second shots come in.
So the state provides them separately, so they break it out. So when they say, we say we got 5,500 first doses, they are truly first doses, and they send a second tranche of a certain amount of second doses to provide for those who received their first doses several weeks in the past.
Okay, thank you.
All right, thank you. Now we move on to Jordan Lindsay, my MC Media. Jordan.
Thank you so much. A lot of my questions have been answered, but I just wanted to get clarification on how many doses the county has gotten and administered to date, and include the allotment that the county has gotten this week alone.
So, as we mentioned, that number is including this week's doses that we got last night that went into circulation today. That's 32,600 doses. As of yesterday afternoon, after we completed yesterday's clinic, we had administered 26,516 doses.
Thank you.
And that's all first doses. I'm sorry, that's all first doses.
Got it.
Okay. Thank you, Jordan. We have a couple more follow-up questions, gentlemen. Rebecca Tan with a post follow-up for you, Dr. Gayles. Rebecca?
He addressed my follow-up question earlier, so I'll send some others privately. Thank you.
Okay, thank you. And then Robert McCarney, also with the Washington Post, has a follow-up question.
Yes, following up on Kate Ryan's good question, my understanding is that when I register, I live in Montgomery, that when I registered with the county, all I was doing was saying, you will send me a note when I am eligible, okay? So I'm waiting to hear from you when I will become eligible. I'm in 1C. So that's with the county's clinics, the county's facilities. But is there a way also to register with the state to be notified when I'm going to be eligible? Or do I need to can I do that with Holy Cross, Adventist, Giant, Safeway, CVS, etc.? That's what I'm not clear about. What I understand how to do it with the county, but I'm not clear if there's a way to do it with the other possible providers.
So I want to clarify, because the terminology. So when you're pre-registering with us, what we're going to send you is, we have a spot for you. Click this link. You can register for an actual time and location. Based on your categorization, you're eligible or not based on our tiering. But what you'll receive actually from the county is, we pulled your not pulled your name out of the hat, but your name has come up as being it's your time. Here is a link to register and pick a location. That's when you'll hear from the county. We'll provide updates and other things like that, but the ultimate endpoint of the pre-registration process is, we have a spot for you. Not you're eligible, meaning you're in the category of people doing, but we actually have.
Right, I understand that, yeah. But I'm waiting. At some point, I will get an email from you. Here's a link to sign up.
Correct.
Okay, that's going to be weeks from now,
Presumably,
based on where you guys are and where I am. Can I pre-register the same way, either on the state site or for the Giant, Adventist, CVS, et cetera?
Most of them are not doing a pre-registration now. I don't think any of them are doing really a pre-registration now that I'm aware of, and certainly if I'm incorrect, then I'll correct it for you. Most of them are doing essentially, like for example, the Giants are, they're open, or for example, Holy Cross right now is 4 o'clock on certain days. They say call, and if you get in, you get in, you get appointment, you get appointment. They're focused on certain groups. They'll verify that you are, for example, I think they were looking at a 1B, so you have to be an educator, 75 or above, or any of the categories that the 1B for the state. Right now, Hopkins is largely drawing from their internal 27,000 65 and older people who have interfaced with Hopkins in the last 2 years in Montgomery County. So it will vary by location, but I am not aware of any other entity that is allowing a pre-registration process, with the obvious exception that we are hoping that we will have other providers accept from our pre-registration list, because obviously that's an easy way for them to find people who are interested in receiving the vaccine.
Okay, and then just one other follow-up on something Mark said. So I'm in the 65 to 74 category. Okay, and I'm not asking for myself, I'm asking to just sort of explain to the public. So if I were able to get an appointment at Giant or Holy Cross or Adventist, in theory, I could do that even though I'm not supposed to. Is that basically the message? In other words, I'd be cheating if I did that.
No,
I see Mark.
That's a dicey way.
What?
That's a dicey way of framing it. Look, if you do it at the county site, we're telling you, please don't do it, because we alone are absolutely responsible for getting that 75-year-old group done.
Right.
Travis is working with the other folks to do the same thing. I would, if it was me, the 1Cs would have been held off until this group was completed.
Right.
If you feel safe and aren't burning to get the vaccine tomorrow, and you'll stay in your house and you'll keep your mask on when you go out, I would ask you to wait. But if you feel that there's a need, then I'm not going to say, and I can't tell you can't do it. I'm just going to say, think about where you sit compared to other people.
Right.
And do you need it or don't you?
And the governor's saying the same thing. Please don't do it.
Yeah.
Even though it's technically allowed, he's asking us not to do it. It's like a civic responsibility appeal.
Yeah.
Good. Okay.
We've responded to civic appeals before.
Yeah, that's fine. I'm just trying to get a.
And to be clear, you're not breaking the rules if you're in 1B or 1C and going to the sites where you are eligible. You're not breaking the rules for those sites that are eligible for that. So, for example, Hopkins met with Dr. Gayles and I on Sunday morning and said, we'd like to vaccinate these groups of people. Are you okay with that? And we agreed we were okay with that, even though they are focusing on 65 and older instead of 75 and older. They came to us and said, are we okay with that as a strategy? And we were. And so, including MCPS staff and faculty in that as well. And so we're really trying to, and this is one of the things that the county executive he talked about with the governor, is have a holistic all county strategy where we may be focused on a particular set of high priority groups, and other entities within the county may be covering other portions of the 1C category, for example. And so it's really meant to be an all of county sort of strategy. Frankly, we need to continue to try and build more collaboration so we can have these, using the same pre-registration list as an example. So you're only going to one place to pre-register. That's a really good example of some things that we're working on building out on. But I think just to the point that you raised, you're not doing something wrong if there's an entity like the Giants or Hopkins that's saying they're going to do 65 and over. You're not breaking the rules going there. We're just saying if there's a specific target for the clinics, stay within the balance that they sort of set forth on those clinics.
Thank you, gentlemen. Well, we've been at this for a little bit over an hour. We need to close. Reporters, if there are any pending questions, please do email to us at the Office of Public Information. Thank you, everyone, for participating today, and we'll see you next week. Thank you.
We'll be back.
Thank you.
Thank you.